My name is Jennifer Cannon, and I'm going to talk to you today about Ebola virus and avoiding a pandemic. What is Ebola virus? The virus is believed to be endemic to Africa. The outbreak that led to the discovery of Ebola virus took place in northern Zaire, which is now the Republic of Congo, near the Ebola River in 1976. In that outbreak, there were 318 cases, 280 of which resulted in death. The virus is part of the family Filoviridae. Viruses in the family Filoviridae encode their genome in the form of single-stranded, negative-sense ribonucleic acid. The disease is characterized by hemorrhaging, fever, and often results in death. How is Ebola transmitted? Exposure to infected bodily fluids is the way that Ebola is transmitted. The Ebola transmission in the 1976 outbreak has been linked to Yambuku Mission Hospital, where patients who presented with Ebola were initially treated with an injection for malaria. Infected, unsterilized needles were then reused on other patients, contributing to the spread of the disease. The hospital was shut down 4 weeks after the start of the outbreak, when the epidemic reached a peak. Cases began to decline after the closure of the hospital. Transmission routes include caring for an infected person, pretty much any interaction with an infected person or the cadaver of someone who has died from the virus, or attending the funeral of an infected person, as well as sexual intercourse. What are the symptoms of Ebola? Symptoms may appear anywhere from 2 to 21 days after contact with the virus, with an average of 8 to 10 days. Many common illnesses can have these same symptoms, including influenza or malaria, which is the cause for misdiagnosis. Symptoms, as you can see here, include fever, headaches, sore throat, abdominal pain, myalgia, nausea, arthritis, as well as lack of appetite, chest pain, chills, tinnitus, and vertigo. What are the signs of Ebola? Ebola has some very distinct signs, including bleeding from the nose, as seen here, diarrhea, bloody diarrhea, oral and throat lesions, vomiting, conjunctivitis, cough, abortion, edema, and jaundice. Other signs include amenorrhea, ataxia, dark urine, dysarthria, hyperhidrosis, lymphadenitis, paralysis, polyuria, and a very distinct rash on the skin. What are the recommended treatments for Ebola? According to the Center for Disease Control, providing fluids and electrolytes to prevent dehydration through infusion into the vein or an IV, as well as offering oxygen therapy to maintain the oxygen status of the patient, using medication to support blood pressure, reduce vomiting, basically secondary effects of the disease, diarrhea, and to manage fever and pain. Also treating any other infections that may occur simultaneously. The 2014-2016 West Africa Ebola virus disease outbreak caused 28,000 suspected or confirmed cases of Ebola, as well as more than 11,000 deaths. According to the Partnership for Research on Ebola Virus in Liberia 2, or PREVAIL 2, fragile healthcare infrastructures severely compromised by past years of civil strife played a substantial role in the propagation of the outbreak, and a lack of therapeutic events and vaccines with proven efficacy against EVD further contributed to the ultimate magnitude of the epidemic. PREVAIL 2 conducted a randomized controlled trial of ZMapp for Ebola virus infection. Data from studies in non-human primates suggested that the triple monoclonal antibody cocktail ZMapp could be a promising immune-based treatment for Ebola virus disease. However, based on PREVAIL 2's study, they determined that in this randomized controlled trial, although the estimated effect of ZMapp appeared to be beneficial, the result did not meet the pre-specified statistical threshold for efficacy. During the West Africa outbreak, the World Health Organization funded a vaccine trial with Ebola ça suffit, or Ebola that's enough. It is a recombinant replication competent vesicular stomatitis virus-based candidate vaccine expressing a surface glycoprotein of Zaire Ebola virus. The results of this particular study add weight to the interim assessment that the vaccine offers substantial protection against Ebola virus disease, with no cases among vaccinated individuals from day 10 after vaccination in both randomized and non-randomized clusters. While additional research is needed for vaccines and treatment for Ebola virus, with so many survivors of the last outbreak, it has also come to light that there are long-term effects of this disease, including headaches, vision loss, hearing loss, and a study by the University of North Carolina at Chapel Hill, along with Duke University and the University of Liberia, have found that Ebola virus ribonucleic acid can be detected in the semen of some survivors for more than 2 years after the onset of their infection. There is a concern that this could contribute to the dissemination of the disease again. They will continue to study this, as well as other ways to treat and prevent the disease and ultimately prevent a pandemic. Here's my bibliography. I hope you enjoyed my slideshow and learned a little something about Ebola virus. Thanks.